Hi, my name is Kelvin Palera, and this is Nursing Foundation 2 Lab Assessment number 1, staple removal, dressing change, and DARP. First in the procedure is hand hygiene. Before you start any procedure, it's good to do a hand hygiene, or if your hands are visibly soiled, wash your hand with soap and water. And once your hands are dried, you want to verify the physician's order, which is do not change dressing until POD number 2, reinforce PRN. Then cleanse incision with 0.9 sodium chloride every 2 days and PRN. And the next orders, remove alternate staples on day 14 and apply Steri-Strips. Cover with sterile 4x4 gauze, and remove remaining staples on day 15, which is today. So yeah, and then after that, you wanna verify your patient's allergies, which is penicillin. And next is you wanna verify the patient information. You wanna match the order paper with the patient band. Make sure that it has the same name, like patient name Mr. Thomas Clark. Hospital number is 1252569. Gender is male. Date of birth it's 1952 December 6. And room number is BVC 704. And the physician is Dr. Gregory Sparks. And once you verify that everything match up, it's time to do your procedure. First, you wanna put on your gloves. And once you done your gloves, you wanna check for pain assessment. Ask the patient in a scale of 1 to 10, 10 being the highest, how would you rate your pain right now in the incision?
Just two.
Okay, maybe it's just because of the incision, and we'll find out. And you want to take off the all dressing layer by layer and away from the patient's line of vision. And after you remove the old dressing, you might want to dispose of it and make sure to and together with the gloves, and make sure if you can take off your gloves, you do it the right way. And once it's gone, you wanna do a wound assessment. So with this kind of wound from incision, you're looking for like a drainage or if the wound is opening up. But this one looks like the edges of the wounds are tightly fit together, so it looks good. And after that, you want to do another hand hygiene. And once you're your hands are dried again, you wanna set up your sterile field, and make sure that your tray doesn't have a hole in it, it hasn't been open, just to make sure it's still sterile. And you're gonna open it. Alright, so I'm not gonna use the first one, so I'm gonna dispose it. And the second one, you wanna hold it on the edge. And keep it above your waist so it's keeps sterile. And grab the other edge with your other hand and set it up. And you want to put your normal saline on your tray. So and here's my normal saline, and I'm gonna check it 3 times to make sure that it's the right one. So I'm looking for 0.9% sodium chloride, normal saline for irrigation. First one, 0.9% sodium chloride, normal saline for irrigation. That's the second one. Uh, Third time is 0.9% sodium chloride, normal saline. And this bottle has been opened this morning, and it's only good for 24 hours. And the expiry date is tomorrow, so it's still good. And since it has been opened this morning, I'm gonna set up the lid over here and drip some, just to make sure that the tip of the bottle is still sterile, and gently pour some on your tray. Right, and once it's once you have it, It's time to clean the wound. For cleaning the wound, you wanna clean the edges. Then dispose of the gauze. And once you clean it, you're ready to take off the staples. So yeah, time to put on your sterile gloves. Dispose of the and you want to hold it by the edge to avoid contaminating the gloves. And for putting the sterile gloves, you want to put the uh, put the gloves on your dominant hand first, so you do not touch the outside, just the inside. And this glove is a little small for my hand, so trying my best to work it out. But before that, if you're gonna get a glove, make sure that you got the right size, so it's not like this. It's hard to put it on. Before I put that, dispose of this in the garbage. Like I said, it's pretty small, so I did my best to put it on. Alright, now it's time to remove the staples. And you want to count them, you want to put them in the clean gauze here to make sure that you have all your staples, because you don't want anyone getting hurt by it. Like, you don't want that going to the patient's patient's bed or on the floor where it could injure anyone. Or once you take you want to take off alternately, so it won't be hard for the skin. And after that, you want to clean the site where the first two staples are removed, just to avoid the infection. There we go, and dispose of the gauze. And now is the time you want to apply your Steri-Strip. Normally, the count of the Steri-Strip should be the same as the staples that you're taking off, but right now I only have 3 available, so I'm gonna do my best to make it work, because this is the only one that came with the lab kit. Right, the first one. Alright, so these Steri-Strips are pretty strong, so you don't need to apply any pressure or anything there, because it's just gonna deform the skin. So you just want to slap, or you just want to put it in on top there, and then make sure it's secured. And then the next one. Alright, so those two are done, so you could continue your staple removal now. Wiggle it a little so it goes off the... There you go, that's the third one. And that's the fourth one. Make sure that your staple remover not touching the skin, because if it does, it's not sterile anymore. So yeah, you just have to be careful. Alright, and after those two are gone, you wanna clean your clean the sides of where you took off the last two staple for to avoid the infection. So you're gonna do it on one direction only, and after that you can dispose of the gauze. And yeah, you could dry it with, and once you've cleaned it with the normal saline, you could wait for it to dry, or you could dry it with another dry gauze. So right now it has been air dried, so I'm gonna put on the third and the last stair strip that I have. So and this is not good anymore, so I'll just dispose of this. So yeah, again, you don't want to put any pressure on the stair strip or the skin, because this thing is strong and it will hold the skin where it is. Alright, once those things are done, you wanna and make sure that you put the stair strips really good. It's time for you to cover it up in this order. The physician says that to cover it with the 4x4 gauze. So that is what we're gonna do. Cover it and tape it. Make sure it's secured so it doesn't fall off or Alright. Once you're done and you wanna dispose all of the contaminated materials, especially your staples, like yeah, and don't forget to count it like I did. I had all four here, so I can dispose of this staple in the sharps disposal. Yeah, everything here. And make sure to take off the gloves in the proper way. And all of your contaminated materials should be disposed of now. And after that, I'm gonna teach my patient to teach my patient on how to take care of the wound, and I'm gonna do another hand hygiene. And for the gauze, I'm gonna